$10 billion budget gap, many agencies and organizations that rely heavily on state funding are understandably very concerned. Now, one such group is the Family Planning Advocates of New York State. Today, more than 300 of their supporters gathered at the Capitol to lobby lawmakers to spare their funding, arguing that to do so would actually save the state money in the long run. Now, we're joined tonight by the president and CEO of the group, Tracy Brooks. Thank you very much for your time.
Thank you for having me.
So this is a little bit of a hard thing to understand, right? You are basically saying to the state, keep spending because it's going to save you money at the back end.
Well, actually what we know about family planning, and it's been proven time and time again, is for every $1 you spend in Medicaid, you save $4 in Medicaid spending down the line in the same budget year. Additionally, for the family planning, for the reproductive health care that we provide, whether it's cancer screenings, STI treatments and testing, breast health, for every dollar spent in the state, the federal government reimburses us with 90 cents for our Medicaid patients. So we know that in this budget cycle alone, continuing to provide reproductive health care saves the state money. But additionally, since 2008, when the state's been looking at doing reductions, Family Planning Advocates, our members, have come to the table and worked with our lawmakers and our governors and met dollar for dollar where the cuts needed to come from for family planning to be part of the solution.
So you have given up money in the past, is what you're saying?
Yes, we have. What we've done is cut the core service funding so that our health centers could stay open, so that we can have as many appointments and hours for people to be able to access their health care, to keep it the same. What we have done is shown the state places that we believe in, but don't affect health centers staying open.
So what you're saying, I think, is that, for example, something that a lot of people are talking about, which is if you spend on preventative care, for example, in other words, if a woman gets a breast screening and then catches cancer early, she doesn't end up with long-standing, very difficult treatment down the road when it's caught late. Or if you're paying for people to get, you're getting contraceptions, they're not having to get unwanted pregnancies dealt with later down the road, which is more expensive, right?
Correct.
That's what you're talking about. Okay. Do you know what percentage in the Medicaid budget family planning accounts for? It can't be terribly large.
We're not very large.
No.
I wish I could say I was the Hospital Association dollar figure-wise, that we were coming and making those kind of suggestions. But we are, although we're small players, we have been responsible players who have shown the state the way to make the cuts, to make the savings that the people of New York needed during these great budget deficits. We're doing it again. We've been speaking with the new governor and his transition team, the Division of Budget, and our legislative bodies since the summer to talk to them about where cuts, if they're necessary, can be made but maintain core services.
Well, where is an example that you might be able to cut?
Well, certainly when the state was flush, there were wonderful public health initiatives that we all believe in. Well, certain public health initiatives don't go directly to whether or not you can access a health center. So that might be a place that in a time of great crisis, unfortunately, we might not be able to meet that public health need with 100% state funding, but we may be able to find other ways to be able to provide those services to folks, but not hit at the core services of well women visits, of birth control and contraception, of cancer screenings, and the myriad of what our health centers provide. And so those are ways that we've been able to work with the state to say we will find ways to continue to meet the goals of the public health initiatives at the same time that we help the state meet the goal of balancing the budget.
So the governor spoke during his State of the State of a lot of different problems, and he very sort of briefly touched on a few of these core democratic issues, for example, gay marriage, legalization of gay marriage. He didn't talk that much about protecting a woman's right to choose, which is a big touchstone for Democrats.
And a big touchstone for this governor. He has been very consistent and outspoken about.
So you feel comfortable with him?
We do. Right now, the reproductive health care delivery system is not broken, nor is a problem in the state. During his State of the State address, the governor was addressing problem areas that needed reform, retooling, and reworking. Family planning providers are a vibrant network of healthcare providers in the state of New York that the state has grown and built in conjunction with these nonprofit organizations for decades. We continue to be strong, but we need to make sure that we maintain the relationship and the careful decisions on where funding shifts and moves to maintain services.
What about with the Senate now in GOP hands? I mean, I have spoken to a lot of folks, not in your orbit. I spoke to you during the campaign. We talked about a desire to keep Democrats in control, a concern about statewide Republican candidates at the time that we were talking. But also now that the Republicans are in the Senate, we've got some moderate Republicans, and of course it's a Democratic state, and so if they really want to maintain the majority, they might move in that direction. But right now, no one's really talking about, for example, you know, protecting women's right to choose, and that is something that you have legislation that's
Yes.
hanging out in the Senate.
The Reproductive Health Act is still out there. We have the wonderful opportunity to meet with some new senators that we need to speak with, and today our activists got to go in and meet them for the first time. And many of those folks, although they might not be 100% where we are on all of the issues that we care for, certainly have expressed an understanding of our issues and the need to continue to protect reproductive freedoms, reproductive access to reproductive health care. And so we feel very comfortable that we are going to be able to continue to work with the Senate majority, the Republicans, to cultivate more like-minded thinkers. When the Democrats were in office, we had more people who were 100% agreeing with our position, and we continue to maintain that support. But we are excited about working with the Senate majority and working to cultivate more folks that understand that our health centers not only provide the full range of reproductive health care, including abortion services, but also the preventative and primary care. 6 out of 10 people who come to our health centers only seek health care at reproductive health centers. Women of childbearing age, those are the providers that they see. We're primary care providers.
So we will be catching up with you, I'm sure, again, but I want to thank you very much, Tracy Brooks, for joining us again.
Thank you so much for having me.